Hello.
How are you today?
Good.
Good morning, Mr. Pete. How are you today?
Not too bad, thanks.
Well, my name is Surma Subedi. I'm one of the student registered nurse from Western Sydney University. And Mr. Pete, I just read your notes, and it says that you are in a lot of pain. Is that right?
Yes.
The doctor has prescribed you Indone, which is a narcotic analgesic, and will definitely help you with your pain, Peter. So I'm going to give you that medication. Before doing that, I want to confirm your identity, Peter. Can I please have a look at your armband?
Sure.
So can you state your name and date of birth for me, please?
Peter Pete.
Peter Pete.
Peter Pete.
Yeah.
Peter Pete. First 1945.
Peter Pete. First of 1945. First of and your MRN is 123754. 123754. That's right. And Mr. Pete, do you have any allergies?
Yes, penicillin.
Yeah, so you are allergic to penicillin. That's why you've got the red band. So Mr. Peter, the medication that I'm going to give you is different than penicillin. So I'm hoping that should be fine. Before that, so are you in the pain at the moment?
Yes.
Okay, I'll give you a scale of 0 to 10. 0 being the lowest pain and 10 being the worst pain. What is the pain score?
8.
8. That means it's quite severe. So yeah, that's why I'm going to give you the Indone, and it's definitely going to help you with the pain. Also, tell me, do you feel the pain when you move, or how bad is the pain?
It's quite bad. It's kind of sharp pain on my chest area. And it's just there at the moment.
Okay, so it's exactly in your chest, is that right?
Yes, exactly in my chest at the moment, but it's kind of radiating towards my back side a bit.
Okay, so it's even radiating towards the back side.
Yeah, it's kind of, yeah.
Yeah, and is the pain dull, or is it sharp, or is it soothing?
It's very sharp.
Very sharp. So Peter, can you tell me when did the pain start?
As soon as I came here.
Okay, alright. So, okay, without delaying any more time, I'm just going to get your tablets, okay? And I'll be back with your medication, Peter. And just before that, I want to do a set of vital signs. That is your temperature, pulse, your respiration, and your blood pressure, and your SpO2. That is your saturation level. Just to make sure everything is good, you know, before giving the medication. Is that okay with you?
Yeah, sure.
Okay. So Mr. Peter, I've just done your vital signs and everything is within the normal range. So I'm quickly gonna go and get your medication. Meanwhile, if you need me, just press this buzzer, okay?
Okay.
Rosina,
Yeah?
please be my second RN to validate my order.
Yeah, sure.
So here I have Mr. Peter Pitt. Mr. Peter Pitt, I have just confirmed his identity, and he is allergic to penicillin. So he's got the red band as well. And our medication is oxycodone. That's the date of the prescription. It's going to be given per oral, and the dose is 7.5 milligrams twice a day. And it's going to be given for his pain, as he stated that he is in severe pain. And the doctor has written his name and also the signature and his contact number here, and hasn't been given today. So this is a valid medication order. So this is a valid medication order because it is within the 7 days time frame. So I'm just gonna look at the names and find out more information about the drugs. So here I have Indone, which is also known as oxycodone hydrochloride. Yeah, and the drug is normally given for moderate to severe pain, and our patient is in severe pain. So the contraindication for these drugs are opioid narcotic hypersensitivity. So if the patient is hypersensitive to anything, we can't give this drug. If the patient has acute respiratory depression, cardiac arrhythmias, or bronchial asthma, we are not giving this medication. And some of the adverse reactions of these drugs are GI upset, constipation, weakness, faintness, orthostatic hypertension, vertigo, and drowsiness. And the precautions for this medication are high dose prolonged use, acute asthma, COPD, and decreased pulmonary reserve, respiratory depression. So the dose that is prescribed is 7.5 milligrams as per our medication chart. Here says 7.5 milligrams. And also the nursing consideration for this drug would be, I would go back to the patient and I would check his severity of the pain. I would do a pain scale measurement, and also I would do a set of vital signs just to make sure he doesn't have any respiratory depression or hypotension, as it says that it can have such effects as a side effect. So these are the nursing consideration for the drug. Now I'm ready to go to the asset cupboard and do my first drug check. So will you come with me to do that?
Yes.
And this one, half tablets. Okay, can we sign it? Register book. Today's the 23rd. 18.
So Regina, will you please be my second RN to do my first drug check here?
Sure.
Thank you. So here I have Mr. Peter Pitt. I have already confirmed his identity and he is allergic to penicillin. So this is our medication chart. Here. That's oxycodone hydrochloride, and Indone is its brand name, and it's going to be given per oral. The dose is 7.5 mg, but the dose here comes in 5 milligrams, so I'll have to do a drug calculation. Signed and printed by the doctor and hasn't been given in today's date and time. So it's normally given twice a day. It's obviously going to be given for his pain, as he has severe pain. So, and the expiry date for the medication is 2020. That means it's not expired yet. Do a math calculation here. That is the strength required. The strength required that we have is 7.5 milligrams. Strength in stock is 5 milligrams, and so there into SP, that is 7.5 milligrams by 5 milligrams into strength volume is 1. That gives us 1.5 tablets. Okay? So do you agree with this calculation? So I'll explain you a little bit about this. So here 5 milligrams means that I have to take 2 tablets out, and I'll have to use a clip cutter and cut the tablet into half and discard the 0.5 and use only 1.5 to give it to my patient. Okay, so now I'm gonna do my second drug check. Okay. So that is Indone. Before that, I'm just gonna pour my medication in the kidney tray, and we'll do a count of the balance here. So this is empty now. I poured all the medication there. And meanwhile, we also have a look at this is the register book where all the asset medications are normally registered. So it says the last balance was 26.
Yeah.
Here.
Yep.
So let me count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
Yeah.
So there's 26 of it. Do you agree with that?
Yes, I do.
Yeah. And now I have to take 2 out from here. Just don't want to touch it by my hand. And now we'll do our second drop check. Okay. So oxycodone, which is also known as Indone, oxycodone hydrochloride, 5 milligrams. Expiry date is 2020. And I have already counted the medication, and there's 26 of it. The medication is already signed and printed by the doctor. Hasn't been given today, so I'm ready to give it to the patient. So here the medication is half now. Put it back. And as it says that we just need 7.5 milligrams, which is 1.5 tablet. I'm going to discard the half tablet. So now I'm going to write it in my drug book. So it's today's date, that is, and the time is 8 o'clock. So I'm going to give this 1.5, and I've discarded 0.5 right in front of you. So now the balance will be 24 because we have already taken 26 out, but we'll do one more count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24. Yeah. The prescriber name is P. Brown. And supplying person, that's me. So I've done this. Now I'm just going to put these tablets back. Rosina, will you please be my second RN to do my third drug safe?
Yeah.
Okay. So here I have Mr. Peter Pitt. I have confirmed his identity. Peter Pitt, 1st of 1st, 1945, and confirmed his MRN number, and he's allergic to penicillin. And the medication that is prescribed is oxycodone, and it's prescribed today and going to be given per oral, 7.5 milligrams. I've worked the calculation out. It says 1.5 tablet, 1.5 tablet. I'm already done the drug register book. Expiry date for medication is 2020. And also the medication hasn't been given today, which the medication is narcotic analgesic, and it's going to be given for the patient because he has severe pain. So now I'm ready to go to my patient and give it to him. And I'll just make sure that I lock the cupboard because I want to put this back.
Yep.
Hello, Mr. Peter. I'm back with your tablets. So, how are you feeling at the moment, Mr. Peter?
Still pain.
Yeah. So I've got your tablet here. Before giving it to you, I just want to say a few things, Mr. Peter. So this is narcotic analgesic, and you know, after taking these tablets, you might get GI upset, a bit of drowsiness, or lightheadedness. So if you experience any of this, you just press the buzzer immediately, and I'll be here for you. Okay?
Okay.
So before giving this tablet to you, I want to confirm your identity. Can I please have a look at your armband?
Yeah, sure.
So let me compare your name here. Can you state your name and date of birth, please?
Peter Pitt, 1st of 1st, 1945.
Yeah, Peter Pitt, 1st of 1st, 1945. Peter Pitt, 1st of 1st, 1945. That's right. So your MRN number is 1237541, 1237541, and it's 1237541. Do you have any allergies, Mr. Peter?
Yes, penicillin.
Okay, so you're allergic to penicillin. Comfortable, Mr. Pitt?
Yep.
Alright, so I've got your tablet here. That's your tablet. A little bit of water for you. Here you go.
Thank you.
And would you
Thank
like
you.
some water?
Oh, yes, please. Thank you.
So, Mr. Peter, I have already explained you the side effects for this medication. However, if you feel like you're having problem breathing and you're feeling a bit palpitation or anything, just press the buzzer immediately. Okay, Mr. Peter, I've already explained you what you need to do. Also, I'll be back after 15 minutes and I'll make sure that your obs are also normal, okay?
Yeah.
And meanwhile, just press the buzzer and get some rest. Thank you.
Yeah, thank you.
So, just gonna, Rosina,
Yeah.
would you please help me to sign this medication chart
Yeah,
in the
sure.
drug book?
Yeah.
So here I've done this already. So this is transfer. This is today's date. This time is 8 o'clock in the morning. Peter Pitt. Amount given is 1.5. Discarded 0.5. And I discarded in the sack trolley because according to New South Wales health policy, it's a very hazardous thing for the environment. So we just dispose it in the sack trolley.
Okay.
And balance is 24 as we took 2 out. I've signed here. I've written my name and signed here. So it's for your name and your signature.
I'll do that.
Thank you. Also my medication chart. So the date is 5/3/053. That's right. 8 o'clock. That's my signature, and I want you to sign over here.
Yeah.
Thank you. Just quickly wash my hand.